article is about the most important categories of intervention in systemic family therapy assessment. This article delves into the specific strategies that experienced family therapists use when helping client families move from their initial linear and blaming views of their problems towards a more systemic organizational understanding of their problems. When families come into therapy, they have a one-sided view of their conflict and maintain that the blame resides within one individual or circumstance. The goal of structural family therapy assessment is to help clients understand their individual roles in their family's conflict and help them understand that their problems are interactional. The point of systemic family therapy assessment is not to confirm that it's either the family that is the problem or that one individual is the problem. Rather, the point is to recognize that it's both the family and the individuals that create conflict in families. The driving force behind the current study is Minuchin, Nichols, and Lee's four-step assessment model for shifting families towards a more systemic view of their problems. This study aimed to expand this four-step model into specific interventions that therapists use to move families towards a more systemic view of their problems. To accomplish this, we used 10 videotaped therapy assessment sessions and 3 clinical raters categorized interventions using a category-based filtering method, in which interventions were written down and categorized into already existing categories or became categories in and of themselves. Intervention criteria consisted of questions or statements that challenged family members' linear thinking and that challenged them to see that their interactions might be perpetuating their problems. As a result, we came up with 25 categories of techniques that experienced family therapists use to challenge linear thinking and move families towards a systemic understanding of their interactions. The most frequent of these interventions was therapist describes the organizational pattern in the family. For example, unless you spend more time with your wife, she will spend more time with your daughter, thus describing that the wife is disengaged from her husband. Describing a family member's role in perpetuating an interactional pattern was also most frequently observed. To a teenage son, a therapist said, "You need to let your parents have a relationship of their own and not get into the middle of that." Describing a problematic interactional pattern involving the roles of 2 family members was also frequently observed. This involves the therapist painting a picture of problematic interactional patterns between 2 clients so that they can recognize their individual roles in the conflict and change for the better. Lastly, initiating an enactment or directing family members to talk to each other productively about a specific component of the conflict was also frequently observed. For example, can you talk with Jerry about why it hurts you when he ignores you? The findings from this study are useful to family therapists in their efforts to help client families begin to understand some of the interactional influences of their problems. We believe this is the first step in describing specific tactics to enact positive change within families. Happy reading.